31. How does the respiratory system contribute to the body's immune response? The respiratory system helps protect the body from infections by filtering and trapping pathogens in the mucus lining the airways and by producing immune cells and antibodies to fight off invaders. 32. What are the effects of chronic obstructive pulmonary disease (COPD) on the respiratory system? COPD is a progressive lung disease that causes airflow limitation, leading to symptoms such as shortness of breath, coughing, and sputum production, and increasing the risk of respiratory infections and complications. 33. What is the role of the epiglottis in preventing aspiration during swallowing? The epiglottis covers the trachea during swallowing to prevent food and liquids from entering the airways and instead directs them to the esophagus for digestion. 34. How does the respiratory system adapt to changes in physical activity or stress? During physical activity or stress, the respiratory system increases oxygen intake and respiratory rate to meet the body's oxygen demands, helping to supply energy and support heightened metabolic processes. 35. What is the significance of pulmonary function tests in assessing respiratory health? Pulmonary function tests evaluate lung function, capacity, and efficiency, helping to diagnose respiratory conditions, monitor disease progression, and assess response to treatment. 36. How does the respiratory system regulate the body's temperature and moisture levels? The respiratory system helps regulate body temperature by releasing heat during exhalation and conserving moisture by humidifying and warming or cooling incoming air as needed. 37. How does the structure of the alveoli facilitate efficient gas exchange? The alveoli have a thin membrane that allows for rapid diffusion of gases between the air in the lungs and the blood, maximizing the exchange of oxygen and carbon dioxide. 38. How does the respiratory system respond to allergens or irritants that trigger an allergic reaction? When exposed to allergens, the respiratory system may mount an immune response, releasing histamines and triggering symptoms such as inflammation, congestion, and difficulty breathing. 39. What is the difference between obstructive and restrictive lung diseases in terms of respiratory function? Obstructive lung diseases involve narrowing of airways and difficulty exhaling, while restrictive lung diseases restrict lung expansion and affect the ability to inhale fully, both resulting in breathing difficulties. 40. How does the body adjust its respiratory rate and depth during rest, exercise, and sleep? Respiratory rate and depth vary based on the body's oxygen needs and metabolic demands, with respiratory rate typically increasing during exercise, decreasing during rest, and possibly fluctuating during sleep cycles.